Hi everybody, my name is Mackenzie Mall and today I'm going to demonstrate you how to do a head-to-toe assessment. I've been a nurse for almost a year now and have found that in order to be a good nurse, it's important to be able to do a good head-to-toe assessment. This is my sister Madalena and she's an 18-year-old female and she's going to be my patient for this assessment. Some things you'll need for the head-to-toe assessment include a stethoscope, a pen light or a flashlight, a blood pressure cuff, a thermometer, and a watch with a second hand. The first part of the head-to-toe assessment is get a set of vital signs. A lot of times your nurse's aide will get your vital signs for you, but it's important for the nurse to be able to get their own vital signs as well. Things included in the vital signs include temperature. You can either do it under the arm, axillary, in the ear, or in the mouth orally. You'll want to get a blood pressure. You can either get their blood pressure automatically or manually. Manually, you'll get a blood pressure cuff. Have the patient put their arm out and put your stethoscope on the brachial pulse, pump up the cuff, and listen to the sound as the cuff goes down. A pulse, you'll take the patient's arm, put 2 fingers about near the thumb, the radial pulse runs with the thumb, listen for 30 seconds, and multiply it by 2. You're going to do this when you watch their chest move up and down to get their respiration rate. A lot of times it's good to distract the patient when you get the respiration rate to get an accurate number. Another thing they just incorporated into the vital signs is pain level. You're going to ask them on a scale of 0 to 10, 0 being no pain and 10 being the worst pain possible where their pain falls. So the first part of the head-to-toe assessment, you're going to look at the head. You're going to look at their hair. You're going to look at in their ears. You're going to ask some questions like their name, their date of birth, where they are currently, who the president is, and this is going to determine their neuro status and see if they're alert and oriented times 4. You're also going to look at their pupillary response by looking in their ear or in their eyes. And if their pupil restricts, that's a good sign and shows that their neuro response is intact. The next part of the assessment is you're going to look at the chest. You're going to look at their chest to see how they're breathing. And this is where you're going to listen to the heart at. The heart is on the right or the left side of the body. And you're going to make sure their rate and rhythm is regular. And this is where you can listen to the front of the chest to their lungs. You're going to listen anteriorly in the upper lobes of the lungs, as well as in the bases of the lungs. You're going to ask them questions cardiac-wise if they're having any chest pain. And you're going to listen to the back of the patient at their lung sounds. You can listen to the upper lobes. And you're pretty much just outlining the lungs. And you're going to listen to the lower lobes. And questions regarding respiratory status is if they're having short of breath, if they're on any oxygen at home. And you're going to listen for if they have clear lungs, if they have crackles, wheezing, bronchi. Typically in a healthy adult, they're going to have clear lungs. So the next part of the assessment is the abdomen. So questions regarding the abdomen, you're going to ask them if they've had any nausea, vomiting, diarrhea. And you're going to listen to the abdomen starting in the right lower quadrant and following the intestinal tract with 4 spots to listen to. And you're going to typically hear a gurgling sound, which is good. It means their bowel sounds are moving. You typically listen in each spot for a minute until you hear bowel sounds, and if you don't hear bowel sounds, you have to listen to each spot for 5 minutes. So the next part of the assessment is the lower half of the body, the legs, and you're going to look at their skin, feel the temperature of their skin, see if there's any swelling or bruising. If this one leg's colder than the other, could be something cardiac or peripheral or vascular-wise. And you can actually learn a lot about the patient by them just walking into the room. You can see how they ambulate, how they breathe when they're not hooked up to any oxygen and simply walking to the room. The eyes and ears for a nurse are the best resources that we have. You can know a lot about a patient by, like I said, just walking into the room. And now if you or you have a family member in the hospital, you will know what the nurse is doing as she's doing a head-to-toe assessment, and you can ask further questions.